Thank you, Angela. Great panel. It's just getting better and better as the day goes on. All right, it is time for a very special panel today titled New Solutions for Africa. Our next panel is led by the esteemed author of the New York Times bestseller, The Blue Sweater, Bridging the Gap Between Rich and Poor in an Interconnected World. Her name is Jacqueline Novogratz. Please welcome her. Joining Jacqueline are her panelists, a very, very distinguished group of women. First up, the president of the Wellbeing Foundation Africa, Toyin Saraki. Sharon D'Agostino. Tiffany Persons. MELLANA HAILE, and SINOTHOLE MBATHA. Enjoy.
Thanks so much, and good morning, everyone. My name is Jacqueline Novogratz. I actually run the Acumen Fund, and we invest in entrepreneurs, African entrepreneurs that have African solutions to African problems. And so this panel means an extraordinary amount to me. And the women who you will be meeting are truly remarkable individuals in their own right. So we really want to have a conversation. We know we don't have a lot of time, so if we talk fast, forgive us. But you know, I've actually been really angry lately, frustrated. Over the last years, I've been working in and out of Africa for over 25 years, at how facile we so often are when we think about this remarkable continent. We have people who characterize it as pathetic, starving, people who really need our help. And on the other side, we read of wars and conflict. And a friend of mine who's one of the great Kenyan writers, Binyavanya Wainaina, wrote this very, very provocative piece in Granta about 10 years ago entitled How to Write About Africa. And while we're not talking here about literature today, we're talking about real solutions. I thought to put in perspective why it's so important that we bring nuance and provocation to this conversation, that I would read just a little bit of his treatise, remembering again that he's talking about if you were to write a novel, he's giving you advice. So he says, in your text, treat Africa as if it were one country. It is hot and dusty with rolling grasslands and huge herds of animals and tall, thin people who are starving. Or it is hot and steamy with very short people who eat primates. Don't get bogged down in precise descriptions. Africa is big, 54 countries, 900 million people. The continent is full of deserts, jungles, highlands, savannas, and many other things, but your reader really doesn't care about any of that. So keep your descriptions romantic and evocative and unparticular. He goes on, broad brushstrokes throughout are good. Avoid having the African characters laugh or struggle to educate their kids or just make do in mundane circumstances. Have them illuminate something about Europe instead, or America. African characters should be colorful, exotic, larger than life, but empty inside, with no dialogue, no conflict or resolutions in their stories, no depth or quirk to confuse the cause. Now, obviously, fully tongue-in-cheek, taking on the scores and scores of books around that are written in too simple of terms, and that's really the situation that we want to look at and talk about today. We have a real chance to make change in partnership if we invest in individuals who are taking on enormous problems, because indeed the challenges are huge. 580 million Africans have no access to electricity. 225 million people get malaria every year, very high levels of illiteracy. We're looking at private equity come in on the one side with a big land grab, and on the other side, aid trying to work with agriculture, often with great failure. We're overlooking the individual citizens who are doing extraordinary things, and through my work, I've seen them truly transform entire industries, whether it's hybrid seed production, toilets and better sanitation, that are financially sustainable as well as scalable. Each of these women here today represent individuals who themselves have made decisions to use themselves only to help release the energies of individuals within the states or across states on the continent to really extraordinary effect. And so I start this conversation as a real optimist, and I am very, very certain that you all will leave this conversation as optimistic as I am. So quickly to introduce who's actually sitting here with me, and it's very, very broad and beautiful. Let me start with Toyin Saraki. Toyin is a lawyer by training, and as we were talking before, really thought about the fact that she's worked in every sector. A lawyer, private practice, with her own money created a foundation, worked in philanthropy, tried grants, focused on investing, was the first lady of her state, very involved in public policy as well, and so brings a really unique perspective through her Wellbeing Foundation, is really focusing specifically on maternal health, looking at the policy level as well as the grassroots and connecting them too. To her right is Sharon D'Agostino, who in her position at Johnson & Johnson as Vice President Worldwide of Corporate Contributions and Community Relations, oversees all strategic giving at the company, and again is focused on pretty extraordinary partnerships using mobile technologies and other, trying to use the best of J&J to reach low-income women across Africa. Next, Tiffany Persons, filmmaker, has her own directing and casting company, born and raised in Detroit, decides one day while working in Sierra Leone that she's going to do something about the conflict that she sees and what happens when people are ravaged by a total lack of trust, and has been working there to really, again, through grassroots organizations, grassroots individuals, through Shine on Sierra Leone, building microloans, education. I'll let her tell you more about it. Exciting stuff. MELLANA HAILE, next. Are you coming from Kansas?
Kansas City, Missouri.
Coming from Kansas. Is at the Kauffman Foundation, which is a foundation wholly focused on entrepreneurship. And she, which is really exciting to me, is looking at reverse innovation. Mobile technologies in Africa that we're bringing to the United States, experimenting with them, as well as some other really interesting work in those areas that she will talk about. And then last, and certainly not least, is the next generation. SINOTHOLE MBATHA, who goes by Sino. You can't help but fall in love with her 5 minutes after meeting her. 19 years old, lost her parents when she was 7. Lots of hard things in her story growing up, but is emerging as a young superstar in that country and a real representative of how bright the future can look. So, welcome to all of you. Thought I'd start with Toyin, who has done so much work, again, crossing the sectors. But one of the things that she's talked about and done something about is the need for implementing personal health records, getting a database where we can even know what we're dealing with in a country like Nigeria, one of the largest countries in the world, an incredibly complex place where records have not been the best. And so I asked her if she would talk a little bit about why, the work she's done, how does this connect to maternal health, and how do we need some of these more edgy solutions to a really, really intractable problem.
Thank you, Jacqueline. Well, I think I should start by explaining why I do my work in maternal health in the first place. I trained as a lawyer, as you've heard, and I had very good education, probably better than most people in my country, because my parents were very, very liberal and they believed in education and a global education at that. But anyway, 19 years ago, I found myself in a hospital, in the labor ward, and even though I was very prepared of what to expect on the best outcomes of pregnancy and delivery, I was totally unprepared as what to expect when everything goes wrong. And I found myself in this situation. I delivered a set of twins 12 weeks early, so that's a 28-week pregnancy. One died and the other one struggled for a long time through prematurity. I was in a resource-constrained facility, but I had intelligent people around me who knew what they needed, and I was sharp enough and smart enough to work with my doctors and know I had a documented history to know where to get the help and where I needed the help. But at a point, my doctors said to me, and I'll never forget the day, they said, pray. And I thought, pray? You know, with my education, the issue of prayer never came into it. I thought prayer was for Sundays when you're by yourself, not for when you're going into the operating theater and you're, you know. I mean, one thing I remembered was turning my back, ready for the epidural, and one of the midwives saying to me, oh my goodness, we don't have any of that nonsense here, which is what she called it. But when my baby survived and I survived, I got to thinking, you know, as the grief cleared and my energy started to come back. And I thought, well, if this can happen to me, what about the people who don't have the education, don't have the documented health history, don't have the access to good health care, can't read or write by themselves and educate themselves? What happens to them? And this used to be an unseen, what I will call a majority in my country, because when I started doing this work, originally I took it from a charitable aspect. And I was telling hospitals and people, okay, if you know somebody who needs to have a cesarean and they can't afford it, please let me know, I will give what I can give. And I started the charity. But you know, 8 years down the line, I just realized that charity was not enough. You know, I could continue giving forever, and I might feel a little bit better, but my country needed a greater solution than that. Now, it's not rocket science to know what brings the difference between survival and death, and then even between survival with birth injury and survival to live a full and productive life. It's all about establishing a continuum of care during pregnancy, for the mother to be health literate, even if she's not literate, you know, as in being able to read and write, for her to know what to expect and the signs to see. For the government to honor its promises to have a well-equipped medical facility within easy reach of women. And so I put myself to work. When my husband then went into government and became a governor, I thought, okay, it's going to be very simple. I'm just going to be telling him in the night, you know, you do this and you do that and everything is going to be all right. But it wasn't as well, because it's not everything that governments can do. Governments are very good at putting the policy, but the implementation is often actually left to the civil servants and the private sector. That's where the challenge lies. Do the civil servants and the private sector work together very well? No. And that's where I felt that NGOs can come in to provide a bridge between the civil service, the public service, and the private sector. So we started to incubate models. The first thing I did was I studied, you know, the countries that have a very low mortality rate. What do they have? And I realized they all have very good documented health records so that you can track every single intervention that has happened to women in pregnancy. In my country, a lot of people present in hospital as an emergency, you know, when they're in pain from labor, especially in the rural areas. You present in hospital, your contractions are 2 minutes apart, and the doctor is saying to you, when was your last menstrual period? I mean, the last thing you're going to remember at that time is when was your last menstrual period, how was it? And I thought that since a lot of people present in an emergency, if we have a document that can later be digitalized, where you can see exactly what has happened to every woman, it ticks a lot of the boxes at the same time. Also, I had given so much that I was beginning to worry that one day if I run out, who is going to keep the struggle for maternal health going in my country? And I said, if I write this health record as a sustainable, viable model and give it to people to market so I can concentrate on my advocacy work, the royalties from that can fund my advocacy work, can fund the training of midwives, can fund the other models that we've started, like the community health insurance model, for instance. We partnered with the Dutch government and a local health management agency. And now you can access very high quality package of care from women's contributing only $2 a year. You know, because the Dutch government have underwritten this, the HMO is delivering the care. When I first went to Kwara with my husband,
part of an insurance system.
It's part of a community health insurance system. So we're taking it right to the villages, to people who wouldn't normally have even had access to health insurance. And it's very unusual because a lot of health insurance packages globally actually remove pregnancy and childbirth from their coverage because they believe that it's going to eat into all the money that they make available. But because we had worked very, very closely with this particular model, they agreed to cover pregnancy and childbirth. And what I do from my foundation is in areas where the people are very, very poor, I pay the enrollment fee. for the pregnant women and the children under 5. It's not much, it's $2, and the funds are matched, and people are getting a basic package of care. We have the focused antenatal care that entitles you to 4 visits in your pregnancy, 2 of which you're entitled to scans. Then we have integrated management of childhood illnesses, also covered, which is a government policy. But because I was doing this model, I adopted the government policies. I believe governments can't work alone. Neither do I think they should work in isolation. So we're putting platforms now that can bridge the different sectors so that our people can live productive lives. I'm very excited about it. And I also think that we're showing that solutions can come from within Africa, for the Africans, and we can source the funding also within Africa, so that when foreign partners actually want to come and partner with us, we want you to bring your key skills that we don't have. We don't want you to come and duplicate what we have already and we're doing very, very well, because there's still a lot we have to learn. I'm trying to digitalize the health records. Intel have been talking to me. I'm now talking to people about text messaging for advocacy during pregnancy, because at the end of the day with the MDGs, we're all talking about, getting to the MDGs by 2015. I'm working with the United Nations Foundation, Every Woman, Every Child program. But the truth of the matter is the man on the street and the woman on the street, if you stop them in a market in Nigeria and say, what are the MDGs? They're going to look at you in absolute puzzlement. So we're all here in New York and we're talking about the MDGs, but I want to go back home and do an enlightenment program with songs and jingles and plays and Nollywood stars, so that everybody knows what is this thing that they're calling the MDG and which steps they can use to get to that.
That's so great.
Thank you.
So as you can tell, each of these women could be a session in and of themselves. What you really hear, what I really hear from Toyin, is this remarkable focus on where both market and government has failed, finding a solution and not being ideological, recognizing that you need to have both, and you're just getting started. And some of the things that you need, technology support, digitalization, stuff around text, and then investors, but not people who are just coming in to show you how to do things.
Well, I did say earlier that it's not about bringing a picture of the saddest looking donkey. I think now everybody's looking for impact in their lives and in their actions. And I think Africa now presents a platform where you can see that impact, and you can see it in very many sectors at the same time. I'm happy to invite you all to come and work with us.
Thank you. Sharon, so Toyin starts with partnership within Nigeria and is looking to go out. Sharon brings a really different perspective. J&J, looking into the world, 4 billion people now make less than $4 a day. It's a huge market opportunity, and there's also a huge moral imperative for us to get smarter, and I think more companies are looking at sustainability and what they can do for the world. You've done a lot but on the giving side, but also different parts of the organization, working with maternal health, and would be great if you'd share a little bit.
Terrific. As many of you know, a baby will be born on October 31st, and that baby will mark the 7 billionth person on this planet. So clearly a focus on maternal and child health is critically important. At Johnson & Johnson, we have a long legacy of work that focuses on girls, women, and children. But last year, when the Secretary General of the UN issued his call to action, he said, we really need everyone to step up, or the Millennium Development Goals will not be achieved, particularly those focused on maternal and child health. As this is a space where we have a great passion, we made a 5-year comprehensive forward-looking commitment last year, and we're celebrating the first anniversary of that commitment and have made a lot of progress against that commitment. While in 5 minutes I don't have time to tell you a lot about each piece, I would like to just highlight the focus areas and then talk about one focus that's incredibly important for us. So clearly we are committed to increasing the number of skilled birth attendants. That is a critical component of the work that we do. We are also committed to treating and preventing intestinal worms. We have done a great deal of work in mobile outreach to new and expecting moms in resource-constrained settings so they can get vital health information. We have a focus, because we are a corporation that has incredible research and development capabilities, of really ensuring that we are working to develop new medicines, particularly focused on HIV and on TB. And then a large and very concentrated focus on eliminating pediatric AIDS and keeping mothers alive. But today I want to talk about the sixth area, which is birth asphyxia. And I'm going to ask you to trust me for a moment because I think it's really very important for us to bring these ideas and this conversation to life. So I'm going to ask everyone in the room to close your eyes and take a deep breath. And while I'm not going to take your photograph and tweet it, although I may do that later, I have a stopwatch. So when I say go, I'd like you to take a deep breath, close your eyes, and hold your breath for 1 minute. And I will continue to talk. Take a breath. Go. So we love partners who help us become smarter and who have proven interventions. You're at 10 seconds, just to let you know. Our colleagues and partners from the American Academy of Pediatrics and Save the Children are here today. We're at 20 seconds. But this technique was used at the International Confederation of Midwives by Dr. Volappi, who is the director of neonatologists at Chris Hani Baragwanath Hospital in Soweto, South Africa. Okay, you're at 40 seconds. And what is happening while this golden minute, in this minute, is a baby has just been born. His or her mother does not hear a first cry. If there is not someone there who is trained in neonatal necessitation, that baby dies. That mother has given birth to a live, almost live, baby who dies. And the intervention is really quite simple. Okay, how many of you were able to hold your breath for a minute? Very, very good. I can tell you, I did. We're really quite impressed with that. But that just helps visualize the plight of that newborn who is so ready to be on this planet and needs just a little bit of help. It's a proven intervention. We are partnering, as I said, with Save the Children, with the AAP, and with USAID on helping babies breathe. So, and we're excited about that partnership.
Thanks. And just because I could hardly hear what you were saying as I was focusing so hard on being the overachiever that I am and holding my breath. Sharon, it would be really great in terms of when you look at partners as a corporation, what are the 3 things that are most important to you? We are looking for partners who have a proven track record at the community-based level, because we recognize that no matter where we are sitting in offices around the globe, the people who know best what needs to happen are community-based organizations. So that's the first thing we're looking for. The second thing we're looking for is organizations that have either a track record for innovation or for scaling up proven models. And the third thing we're looking for are people and organizations who have a passion for exactly the work that we do in saving and improving the lives of girls, women, and children. And with how many partners are you working right now?
We have about 600 partners around the world.
Wow. Thanks. Well, we'll get back to this.
Okay.
It's really great. Next is Tiffany, who grew up in Detroit, as I said. And what's extraordinary about her story is in a world where we've got a lot of people saying what's wrong with the world, very few people see issues that are happening, particularly on the other side of the world, and decide that they're going to make that issue theirs. And she is one who, working on a film in Sierra Leone, saw the issue of conflict, what that can do to people, and decided that she was going to change her life, change as many lives there as she could by giving people the tools to change their own lives. And so I asked Tiffany if she would talk specifically about trust, because I think all of us work in that area that is so difficult to measure, but probably the most important thing we can do. How do you build trust in a post-conflict situation where there's very little reason to have it?
Yes, so like you said, I went to Sierra Leone initially to do a documentary where I followed the life of a diamond from the earth to the consumer. And I actually lived in a diamond mining community for 3 months. So that's the beginning of trust, them seeing me day in and day out. And while I was there was a 3-room structure that was burned down by the rebels. And I rehabilitated this with my fellow filmmakers and with $6,000. And when I came back with the supplies, I actually had to go back to America for, I think, a two-week period of time, and I came back. And the entire community spilled into the street saying, you came back, because like that, there was a very low level of trust, and there were so many journalists and writers that had come to this particular village and had never come back for, you know, obvious reasons. It's not easy.
Nor even sent the reports or the articles for people to read.
Exactly, yes. So when I came back, that was the first moment that they completely opened their hearts and minds. So this was truly a possibility for change. And then, as I started to work in the village, I started to listen more and talk less. I think initially we all meaning people who want to help, we go over and we're like, no, I have the answers. Let me just tell you how amazing I am and where I am from is, and we don't. We really don't. So I listen more, and some examples of that, the programs that we've created, I would like to call it like a participatory approach. And the participatory approach is really involving the voices, the hearts, the hands, and the solutions of the people that you're working with, but truly, truly doing it, not just saying it. So some examples of that is there's a method called earth bag building that was created by an Iranian architect by the name of Nader Khalili. And when I saw it in a Whole Lifetimes magazine in Los Angeles, I started to cry because I was so excited at this technique of filling a 100-pound rice bag or flour bag with soil and clay that you pound on top of each other and create a structure that will last for 1,000 years. That's disaster-proof, disaster-proof, so earthquake-proof, fire-proof, bomb-proof, etc. And I took this to Sierra Leone. I was really excited, and I shared it with them, and they were like, ugh, how do you build a building with a bag, you know? So we went through this process of doing it together and modifying the approach, because actually in Sierra Leone you had to do it a little differently. So we hired a group of labor. Actually, the labor was provided for free. They were given a small stipend for food every day because that's what we could afford, but they provided the labor, the sand, and the gravel, and together we built this building, and they had complete input on how it was built, where we had to modify. And then we learned that there are several tribes in Africa, in Sierra Leone, and all of the tribes must be included in a project such as this. That's something I didn't know. But listening, because they were fighting. And so we started to listen, and then we included, you know, a couple of people from each tribe, each of the tribes, and we had 12 tribes, I believe. And at the end of it, it was such a successful project that they asked if we could call the building the Unity Building, because it brought the community together in an unprecedented way. So that's an amazing example. Secondly, maternal health care program that we just launched our pilot program, very exciting. We were told by several NGOs and people on the ground, oh, you cannot work with traditional birthing attendants. Now, traditional birthing attendants are the women who have been giving birth to the people of Sierra Leone for generations upon generations. They're the women that the pregnant women trust. And even though they are mostly 95% illiterate and have no formal training whatsoever, they have hundreds of years of experience. Well, these women, when programs are created and funding comes in, they're usually overlooked because no one really has the time to deal with an illiterate person. So even though we were advised heavily against it, we went and we sat and talked to them. And what we ended up doing was creating a program where we trained them as community healthcare workers, which means they now take blood pressure, they give pregnancy tests. So they give pregnancy tests, malaria tests, they can administer medication for malaria, HIV tests, weighing, scaling, so they're a part of the process. But not only that, they're tested, and because they don't read and write, the test is given verbally, and there's a green box and a red box, and they check off which is right or wrong. And when they graduate and receive their certificate, and they're dressed gorgeous, they're just looking beautiful, and their entire family rushes them because they have their equipment bag, they have their blood pressure, you know, everything with them. And they're hugged and they are unveiled. We call it the unveiling session. And they're unveiled to the community as this community healthcare worker. So for the first time in all of this time, they are looked at as a medical professional.
So you're affording dignity and status.
Absolutely. And now, for last week, we had 7 referrals to the hospital. So what's happening, they still are with these women throughout their entire pregnancy, just as we were before, but they are not charged with the responsibility of having to give birth without any help. They're now the medical professional that stays with them and actually ushers them to the hospital.
That's great.
So last week we had 7 referrals, up from
fantastic.
0. So that's,
Thanks.
Yeah.
Thanks.
Yeah.
It's terrific.
last thing before my 5
Really
minutes
short.
is up.
Your 5 minutes is over.
My last
So
thing
really
is that,
short.
Okay, no, just seeing the people that we work with as the powerful human beings as they are. That's it. And not looking at them any other way other than that.
That's
it.
great.
All right.
Thank you. Thank you. So MELLANA works in Kansas, but with the whole world. Oh, in Kansas City, Missouri. Oh,
Missouri.
Missouri. Sorry, Kansas City.
Yes, exactly.
And what's remarkable in it, we have offices in Kenya, is that when you look at mobile banking, Kenya is so far ahead of the United States. It's almost laughable. You can do almost all of your banking now through your cell phone there. And so there's a real opportunity now to be looking across the continent for innovations that aren't only working and serving large-scale populations in Africa, but to take it around the world. And so it'd be really great to hear what you're doing and where you're seeing application for some of those mobile technologies in the United States.
Absolutely. Thank you, Jacqueline. So before I get into the project, I'm just going to give you a brief backstory of how I even got involved in mobile banking. I'm an architect, so I am not a technologist by any means, but a few years ago, while I was going through my graduate program at the University of Virginia Business School, I was in New York, for an internship, and there I was, gung-ho, an architect. Okay, I'm going to go change the world after this degree, and I stumbled on a boutique firm that does real estate development in Nigeria, and so the project that I was working on was a government housing project. So there we were busting our tails on how we're going to build this project and figuring out the financials. And it was really quite an experience because through the process we learned, it's great, I think the building will be fine, but we looked at the consumer, the end user of the product, and we realized these individuals might really want to buy that house, and it's fantastic for the banks. But the banks, on the other hand, were telling us, I'm sorry, I'm not going to lend anybody anything because I have no idea what their bank information is, what's their credit score, the Equifax and all that we have here does not exist. So there I was stumped. I was quite disappointed because I really had a different view of the outcome for this project. And so this obstacle just seemed to deter us from going forward. So I came back from that internship and I was like, this is quite an incredible thing that we're facing. And I'm sure the consumer at the end of the day would like to get past this. So I was looking at, okay, what sort of innovation is happening so that you can quickly reach out to the consumer or the target group that you're working with and understand sort of their profile. So I kept hearing about M-Pesa, Visit in South Africa, and I was like, okay, this is great. So let me dive a little deeper and see how can I apply this to sort of the problems that we were facing in Nigeria. So I thought, this is fantastic. With all these transactions that are happening on your mobile phone, you can understand where the consumer is buying and selling, and you can actually record that history. It's like, well, we can take that information and create a profile for Kade, who's sitting in front of me right there, and saying, this is what she buys, this is what she sells, this is what she can afford. So I went back and I went into our business incubator at Darden, and I thought about, okay, I can't do this in Nigeria because it's a long way from home for me, but I can do this in the US because we have 44 million individuals or households that don't have a credit line, that don't have access to financial services. So I thought about how awesome would it be to bring the innovation that's happening in Kenya or in South Africa and try to apply it to sort of the individuals that have similar issues to our Nigerian friends. So I said, I'm not going to take that, job after graduate school. I'm going to go into the incubator. And so I did, and I still today can't believe that they accepted me, but they did. I'm not going to tell them about it. So anyways, they accepted me, and I really wanted to use that opportunity to build a proof of concept. And I didn't know what was going to happen, but I was working on the concept, talking to bankers, because I don't have that background, trying to understand what bankers do. I should have known Jacqueline by then. Maybe she would have funded me. So it turned out to be an opportunity to think about, okay, how can we use this in the United States? And what it came down to was, it wasn't an issue of the user not wanting to do this, but it came down to regulations. There's a lot of regulatory hurdles in sort of the telecommunications space, and we're looking at something that's new. And when you look at the profile of the mobile user in the US, it's quite different. We don't really do a lot of mobile banking, and at that time it was just starting to come onto the scene. But it's encouraging to see now that there's a lot of startups, a lot of organizations that have embraced mobile banking and what it can be. So long story short, I wrote the proof of concept, and a good friend and a professor at the Darden School was like, you need to teach this. So that's what I do. I go once a year to the graduate school, and I teach investment bankers and consultants on mobile banking in Kenya and South Africa, and wouldn't it be great if you could do this in the US? And trust me, it was intimidating to sit in front of all these bankers, but from the expressions that I got and sort of that aha that I could see on their faces, I do think that this is something that's going to be more and more prevalent in the US, and especially when we look at the sort of the group that doesn't have access to financial services. And I think this is really important when we're thinking about entrepreneurship as well. Entrepreneurs need to be equipped or feel like they have access to, or need to have access to, financial services so they can build their businesses, grow their businesses, and that's really what Kauffman Foundation is all about as well, is how do you nurture, how do you promote entrepreneurship, both in growing economies and growth economies, I would say.
So, Melina, it's so breathtaking, and it's so got to be the narrative of the future that we find innovation wherever it may be. Sure. And given that there's a lot of greenfields in Africa, sure, my bet is we're going to see more of this.
Absolutely.
What is the biggest challenge that you see to integrated mobile banking for low-income households in the United States? I just read that 44 million Americans make less than $15 a day, or live on less than $15 a day.
Right.
So America looks as much like a developing country as
it is.
The rest of the world.
Absolutely.
But it's hard to get Americans to sometimes see that there's huge opportunity to learn from what's happening in others. So what do you see as the biggest challenge in other places?
First of all, I think it's just awareness. We need to be aware of what's happening, and the decision makers that do say, okay, Melina, you can go and do this right now, need to understand what this can actually mean in terms of long-term, investment and what you get out of it. So to me, it was really the regulatory, talking to the telecom companies was quite a hurdle.
Rather than consumer uptake.
Well, the consumer uptake, I went out and talked to anybody that would listen to me. And so for what I heard from them was, well, I do have the latest, mobile phone, and people have the iPhones or what have you not. So if you put the technology into their hands and made it as easy as possible, they would use it because they understood that this would have an impact, not only short term, but long term. Short term is a savings issue, but long term is you can buy your first house or that car or that equipment you need for your business. So I think once we have sort of the regulatory aspects kind of figured out, I think this will definitely
Great. Thank you.
Yeah.
Thank you. Sino, the youngest by far on the, but with no less of a rich, incredible story that goes from growing up, lots of difficulties, finding Ubuntu Education Fund, which is an extraordinary organization for those of you who don't know it. Take time and find out about it. But would love to know a little bit more about your story. And I was saying to her, that with the theme of listening, which you've heard here, as this young, vibrant, up-and-coming leader in South Africa, what would you advise the president of South Africa?
Okay.
I bet she has a lot to offer.
Okay, before answering the question, I'd like to briefly talk about myself. As you know, I'm Sino. I'm from South Africa. I was born in the province of KwaZulu-Natal in a small township called Umtubatuba. I was only 7 years old when I lost my mother in September 1998. She was close to my heart, loving, caring, and protective person. I felt all was lost as my dad was an alcoholic, and sometimes he would forget that he was blessed with a daughter. I never had time to know him, but I always had hope that someday we'll make a proper father-daughter relationship. But unfortunately, he passed away in October 2001. That's when I started to feel as an orphan. I would feel lonely and abandoned, even though I was surrounded by friends and family. I couldn't find the courage of living. With all that was lost, life meant nothing but struggle and pain. Because of stigma surrounding HIV and AIDS at that time and how taboo it was to talk about HIV and to disclose one's status, I was convinced by my family that the reason for the death of my parents was because of the traditional ceremonies that they did not accept. But now as a grown-up young adult, I confidently believe that it was HIV and AIDS related issue. My uncle who worked as a police adopted me. He also didn't have much to give, but he wanted to get me educated so that I can have a brighter future, just like any other child with parents. Still trying to get over the past, I was blessed with the second home, Ubuntu Education Fund. Ubuntu is an NGO that works with 400,000 people in the community to ensure that an orphaned, vulnerable child could succeed in the world of higher education and employment. I was introduced to this organization in 2005 through the gardening and feeding project that Ubuntu provided to my school. At Ubuntu, I was convinced by one of my counselors that I could become a leader out of the great trauma that I experienced. And so I joined the peer education program in 2008, and I was trained to become a good leader. There's an incredible program at Ubuntu called the Ubuntu Scholars. Because I'm an Ubuntu scholar, I was provided with an extra support in my major subjects. They hired one of the best local teachers who were driven by passion and determination to teach. I was also offered an opportunity to apply in 3 of the best universities in South Africa, including the University of Cape Town, Rhodes University, Nelson Mandela Metropolitan University. As I'm sitting in front of you, I'm a student at Nelson Mandela Metropolitan University. I'm studying the degree of my choice. I'm studying the degree of my choice in environmental health. Now, when I look at myself back where I come from until now, I sometimes get to cry because when I look at my peers who didn't make it and those that are not part of Ubuntu, they don't have success, they don't find the courage of living. And if it wasn't for Ubuntu, I could have been around the street, trapped in hopelessness life, and I could have never found the courage of my existence. And so I strongly thank Ubuntu with that. But then to answer your question, I would say the government should provide the essential services to the communities. For example, we are so fortunate in my community to have the Ubuntu Center around the community because it's a sign of hope to my community as there's a lot happening around. There's a lot of discouragement and a lack of infrastructures. You find out you sometimes start to give up. You don't have a hope of having this brighter future like any other kids around the world. And so I would say the government should provide educational services and also ensure that the healthcare system improves in South Africa.
That's great, thank you. And Sino, what about your personal dream for you?
My personal dream?
Yeah.
From here is to further with my career, and then after that I work for one of the big companies. I give back to my community, and my biggest dream is to become one of Ubuntu's biggest sponsors.
Biggest sponsors?
Sponsors?
Yeah. You go, girl. That is great. My own frustration is I really would love to have a big conversation with each person. We have approximately 9 minutes left. And so trying to think through, since we can't really have a conversation, it might be wonderful just to listen to each of you take 1 to 2 minutes max to talk about your biggest challenge, pursuing what it is that you're trying to do, knowing who's in the audience, you know, what is that challenge, and what's the single reason in a very concrete way for your own sense of hope. Do you want to start, Toyin, or end? It's your prerogative, since you've been so quiet.
And please. You start.
Jacqueline, I will take the opportunity to answer that question as an individual as opposed to as a
J&J.
representative of Johnson & Johnson. And I would say that the single biggest challenge that I see is to really inspire every single person to do something to help girls, women, and children around the world. And it can be next door or it can be in the next country, but every single person can do something. And the challenge, I believe, is that for many, they're so overwhelmed by the issues that they don't really recognize I can make a difference.
That's true. Thank you. That's really good. I'm believing people are they're just passing on, so it's for you, MELLANA.
Okay, so say 2 comments then, and they're kind of morphed into hopes and dreams as well. So I would say dream big, just dare to dream. I think that I just reflect on my experiences.
But what's your biggest challenge?
Oh, my challenge. That's why I said comments. Okay, my challenge is, well, precisely that is sometimes I think we just don't have the courage to, for whatever reason, to think that we can do this or I can do this, my community can do this. And I think it's really important to just embrace who you are, what you do, and dream.
And what about for you personally?
And that's a reflection on my own. I look back at my experiences and I said, well, can I really do this? Are there, these are obstacles in my way, whether it was the mobile banking or, whatever personal reasons. I thought I need to embrace who I am and just go for it. And sometimes I think we just lack that sort of push or that sort of, okay, I'm going to do this now and see what happens. So just reflecting on my own personal experiences, I'd say that is probably the last comment, last thought for this panel today.
And what about hope?
Hope. Women, we are, I grew up in Ethiopia and Eritrea and just really am amazed at sort of the roles that we have as mothers, as leaders, as individuals in the community. And so we need to embrace that wholeheartedly. And I think when because of the roles that we have are undertaking, my hope is that women, regardless of what we're doing, will really step to that plate. And I'm sure we can fulfill it. I think we just need to be, past the glass ceiling. We also need to break the glass walls. So I really do feel that's my hope.
My greatest challenge was revising the way that I looked at poverty. And about 2 years into my work, I became really depressed and very overwhelmed about what I was doing. And I couldn't figure out what it was. And I realized that we were in a really unhealthy relationship. And the relationship was, I need, and I was going to do whatever I can to give. And I knew that that was not who they were. And I knew that that was not who I was. So it was really revising the way that I viewed, like almost eliminating the word poverty and creating a partnership with these people and getting out of the habit of looking at someone's life that is not like mine and saying, oh, this is how unfortunate, oh my God, this is sad, but really seeing them as the person that they want to be and focusing on that, steadfast.
That's great. And what about hope, Tiffany?
What about hope? Hope is great.
What gives you the most hope?
What gives me hope is the incredible stories that I hear every day via internet from the people, the students that are in Shine on Sierra Leone under the Shine on Sierra Leone umbrella, And hearing how happy they are, how successful they are, and hearing of their dreams and ambitions and knowing that they can make it, and now that because of what we're doing together as a partnership, that they feel that they can make it.
Thank you.
My biggest challenge was overcoming the past, but then since like at Ubuntu I was provided with the counselor, so it was through those counseling sessions that I realized I am powerless to change the past, but powerful to change the future. So I would say to other kids like who are at my age, who are also the lost souls, or who are abused, or just who are living in a shell. It's time to break up. I mean, the only thing that can set you free is education, because it was through education that the domestic worker's daughter became the doctor and the farmer's son became the lawyer. So I think we should focus on education. That's where your success will be.
Hard act to follow, Toyin. Hard act to follow, Sino.
She is. It's funny, actually, Sino, because you are a hard act to follow. But in a typical way, actually, you represent what I always found was my big challenge. You know, throughout the time when I would work in communities, my big challenge was actually controlling my emotions. You know, I would come across a situation and literally it would overtake me, and I would go home and cry. You know, you feel fear, then you feel anger, then you feel frustration. And after a while, you know, and I try and expedite the process, I would put my emotions to one side and then drag my education out again to allow me to find a way to treat the problems that I was seeing. Because in a lot of the communities that I worked with, for many of them, I was their only link to the outside world. You know, I was fortunate in some ways, but I don't even know if it's fortunate, because when you see the way things work properly in other parts of the world, and you realize that it's only to just recalibrate a wheel slightly to put the teeth in the right order to make things work, it's very, very frustrating to live with people who don't want to see that this thing can be done. And, you know, the people who are suffering are not the ones making the decisions. So, in fact, when you were talking, I was empathizing with you, and I was thinking about the thousands of orphans that I have in my country, and how would I go back? And, you know, one person can't do it all. How would we convince other people to also give? You know, one person gives money. Money alone can't cure it. Another person gives time. Another person gives of their educational skills. So I was just thinking to myself that, you know, just from the women in this room today, we could create a platform where everybody can give that little bit of time or that little bit of skill that they have. And it even creates jobs for those who actually have the time and can take it as a job of employment to help, you know, people like, you know, what you went through at the age of 7 to lose a mother. You know, we work in Africa, we know that if you lose your mother, it can truncate your future forever. To lose a father, a mother can still marry again, or she can still work very hard, and a lot of women are almost like the men in their families. But it's only a mother that can sense from looking at a child whether that child is going to have a fever tomorrow. So yes, my biggest challenge was controlling my emotions, you know, in what I could see. And also my biggest hope is that that emotion can be used to drive development in a sustainable manner. I'm actually very grateful to be here. I was very excited when I got the invitation to meet women from all over the world, because, you know, one is somewhat insulated to a point. And I just hope that what we've all gathered in this room today, we can all pull together, whether it's the mobile telephony or the participatory development, which I also espouse through my work with Village Earth, or whether it's the technology and the innovation from people like Johnson & Johnson. And then we need to listen to the voices of the people. You know, Sino, she's so young, but she spoke with such clarity, and she helped me to recalibrate, actually. You know, because what we should be doing with our orphans is getting them independent.
That's right.
Not getting them dependent on us forever and feeling good because we're helping them. And so that says it all. I've left with probably more questions than I came with, but I think that I'll be able to take this and work on it and reach out to other people in my country and throughout Africa as well. You know, we should be looking now at Africa as a region, and I'm happy that MELLANA shows that Africa can bring out something that can help the rest of the world, because mobile telephone technology actually has revolutionized Africa. It's put farmers in touch with their markets, it's put mothers in touch, it's changed the face of Africa, and I think we need to continue to harness this, so thank you.
Thank you
very much.
We didn't talk a lot about what it means to be a woman in doing this work, but at a moment in history where I speak personally in saying how frustrated I am by so many of our leaders who fling petty ideologies at one another, each of you who represent different nations and sectors and classes bring forth the best of what it means to be a woman leader. And you are humble, you're listeners, you speak from a place of integrity, a vision, and it's just been an incredible honor to be up here listening to you. And I agree with you, I leave with more questions and answers, but certainly a great sense that we can do it. And I just want to thank each of you and thank everyone for being here, because you're really remarkable. So thank you. So I think we leave now and go have lunch or something. I'm looking over at you guys.